This week's focus is a little bit of this anterior line, this connective tissue system on the front of your body. Now what we're gonna do is we're gonna start with a little TFL, ball focus work on the top of the pelvis. Then we're gonna go to classic long lever quad smash. You just gotta get on your stomach and address the stiffness in these systems. They make a big difference when we have full access to our tissues. We'll go down below the knee, take care of the shin, right? That makes sense because we're just following it down. And then we're gonna tie the whole thing together with a good old-fashioned couch. So what you'll see is, of course, the line gets loaded in a whole bunch of positions, but anytime the hip is in extension, this line really matters. And when we see that we don't have access to it, we tend to wanna turn the foot out. So when we're running, leg spins out, then we have a strike problem, or jerking or lunging, we end up not loading that system effectively. We load this leg, or when we jerk, try to add it fast, this leg dumps power. So it's a problem, and sometimes it's a learned problem because the tissues don't allow us to get in those positions. So if we can restore those positions, we can start getting that leg straight and unlock our potential. Enjoy this week. This is how we're going to address the musculature and connective tissue of the front of the hip. You're gonna need a ball, and what we're gonna try to do is take on what we call our flexor WAD, W-A-D, which is really a combination of connective tissue systems from the anterior fascial chain of the leg and where that drifts into the back. So, and unlike the hip wheel, we're gonna try to go ahead and see if we can improve how the hip is flexing as well. The easiest place to start is to place this near the back of the front of the glute, right where it starts to peel off this flexor WAD. And instead of coming straight into it, what we're gonna do is start at the very top, near the top of the pelvis, and then we're gonna roll forward through that. And working at this end range of flexion for starters. So knee is up near the chest, and I'm just gonna pin that tissue down and then try to roll over it. Pin that tissue down. I'm moving the ball a little bit towards my feet, and then again, starting and doing a slow peel across. I've got 3 minutes on each side to just see if I can cover some real estate. And now suddenly, as I move from the top, it feels like I'm now in this high hip flexor where the quadriceps are coming into the pelvis, and that starts to become very interesting. So I'm gonna work this down and just see if I can continue to bend and push that and restore how those tissues are relating to its neighbors until I start to get into the crease of my hip. So now I'm starting to get right into the crease of the hip here, where I'm starting to run out of space, but that TFL really is playing a big role here. So what I'm gonna do here is I realize that I don't wanna let go, so I'm gonna stop, take a breath in, contract for 4 seconds, and then I'm gonna slowly exhale for a long time, as much air as I've got. If I can get to 6, 7, 8 seconds, the better, and just let my nervous system yield. And this is that combination where we're doing an end range isometric for the musculature and the brain, but then we're trying to address how that musculature is working, and we get that big kind of PNF parasympathetic output when I get that long exhale. Meanwhile, I've got some nice work done on the soft tissue. So what I'm gonna do now is just flip my leg into extension a little bit, and then see if I can peel off that TFL or work on it in a slightly different setup. And that setup is with the leg a little bit straighter. And you're seeing is as soon as you bring that leg back, that tissue becomes like a tent. And you have to go a little bit slower and be a little bit more patient as you yield. Feel free to drop in and contract. Just flex those quads and relax and see if you can sink in slowly. So addressing these tissues in both of these positions makes a really big difference in terms of the quality of function of this hip, looking at the hip in extension, looking at the hip in flexion. So we'll just finish those last 30 seconds here as I pin that TFL in this long lever shape. That means the leg is straight, moving towards extension, and then just slowly rolling over the corner, feeling like I'm transitioning from femur into pelvis, and or rather going from the sort of the pelvis and the hips into the femur. When I start to get the femur, I want to stop. And what we'll hit is the other side now. Whew, it's a doozy. So again, we started trying to rip this flexor WAD off. I come up into the high aspect of the hip. I'm all the way up here. We're looking at some of where these fascial components are coming in, and I just slowly peel to the side, grabbing a chunk of flesh, contract, relax if I don't think I'm relaxing all the way, and then seeing if I can roll all the way through that flexor mass, that big junction of tissues coming together. So rolling that, I've got my hip flexors coming in and tying into the glutes, tying into the fascia of the pelvis. So nice and easy, working on that leg up to the chest. Can I completely relax? And if I want to play with leg position, I can open up. You may have an interesting arc that if your leg is down, it will be different. Your leg is up is different. And then just slowly trying to turn my body. And as I turn my chest to the floor, that's the equivalent of bringing the knee across the body, which loads these tissues up in a slightly different position. Working across, and now I'm just scooting back so I can feel that tissue ball roll over that hip flexor. And then I'm getting near the bottom of the pelvis, sinking in, contract, relax, and then rolling backwards to feel like I can peel that off. And as I transition from pelvis into thigh, things start to feel a little bit different. And I want to see if I can still get this fascia, this muscle bundle, connect tissue bundle, just catching it as it starts to drift into the leg. Again, then I'll switch back to the top, put that leg in extension a little bit, and then just slowly roll through that hip flexor with the leg in that extended position. So if I feel anything that feels fibrotic or stiff or ropey, I'll just take my time, work through it, drop in a contract, relax as I move across, and then just systematically, with whatever time I have left, work my way down with the leg in extension and try to peel that hip flexor from the side. How do I feed that whole thing some slack so that it can better handle the large and dynamic ranges of motion of the hip? This is one of the ways to unload extension in our athletes, is to just give a little bit of slack to the front of the pelvis. And what you'll see is that it's very easy to, again, want to spend lots and lots of time here. We'd rather you take a dose-response sort of approach. We'd rather you put this in your memory banks and hit it tomorrow. 3 minutes aside, really focusing on your hip flexion or hip flexor will improve how that hip extends and how it behaves at end range of flexion. Good job. Simple quad smash should be a basis for a lot of your soft tissue work and home mobilization practice. A lot of times at the front of your thighs just become fibrotic and very stiff, and this can cause a whole lot of leakage of power and potential dysfunction upstream and downstream. So whether we're trying to improve downstream or the hip and low back or improve upstream from the kneecap is obviously a big deal. When we actually get into our work, you're going to either need a ball or a roller, and both of them should be fine. You can alternate back and forth. Now, something that's important is notice that I'm supporting myself on my other leg. That's to get my thigh even with the ground. So there's a lot we can do here, and the first thing we want to do is I'm just going to start in the middle of the thigh, and it may be that in 3 minutes time it's too difficult to get too much up and too much down. The whole thigh. So I'm either going to work up or down. Now, the first thing I want to do is make sure that I'm actually accepting the weight of my leg on there. So I'm going to stop, take a big breath, grab the glute and straighten the leg and flex the thigh for 4 seconds. And then I'm going to slowly exhale and see if I can relax in and actually have the femur make contact with the roller of the ball. That's what I'm trying to think of in my head. And if I am not able to completely relax and come off tension quickly, then I've found stiffness in the tissue that we think is less than advantageous. So most of us are running around with pretty stiff quadriceps. What we see is that typically people are just skimming the surface and not getting a lot of real work done. So without having gone anywhere, I've just go ahead and initiated a big contract relax cycle so I can make sure that I'm actually at the bottom. One of the great things about the roller is that I can add rotation in and scan side to side. And we prefer scanning side to side than rolling front to back. So work from inside the leg across that band. And if at any point you get stopped, drop in your contract relax, work onto the lateral or outside of the band. And while we can't stretch or mobilize very effectively the IT band, we can improve how the musculature is inserting next to it. So right here I'm on the outside of my thigh. It's a little bit tender. I can modulate my pressure with my other leg and on my arms. I drop in a contract. I relax and see if I can sink all the way in. Again, a lot of times when we're seeing people with dysfunction around the knee or the hip, they really haven't done a good job. One of the good job of mobilizing their quadriceps, even though they think they have. One of the nice things about the roller, or roller with texture, is that this gives me, this rumble roller particularly gives me a little bit of an opportunity to scrub back and forth. So this is like taking layers of warm silk and trying to get them to slide over your steel springs. And what we're trying to see here is that if these tissues don't articulate well with their neighbors, then we have high resistance internally, which can lead to loss of efficiency. So you can see that without having to go very far, we've easily sucked in 2 minutes of time here. We're going to try to get 1 more minute. I'm just going to work down a little bit towards the knee. And again, start that whole process. Can I contract, hold, and relax? That's sort of a lie detector test to see if I can get into the bottom and really relax around this, because that's really the goal, is to make sure that I can actually have my brain turn off the musculature here. And then simultaneously, while I'm keeping an eye on breathing, I can scan side to side, looking for stiffness. I can push and pull in a scrubbing fashion that fascia and those deeper layers, just making sure that they articulate and actually slide and can hydrate. And once I've scanned a section, have scrubbed a section, and I can easily contract, relax, and I make sure that I'm at the bottom, only then will I move on to the area. And the way to work around the quadriceps is to think, hey, I've only got to survive 3 minutes of this, so if I get some good work in, it will work through the entire system, and the next time I address my quadriceps, that will be sufficient. So 3 minutes pass, even if you haven't addressed a large area, still try to address some area. So in this time, I'll start a little bit lower, working down by the base of the knee. And again, one of the nice things about being able to support your weight here, if you're at home, you can actually lay on a pillow, is that I can make sure that I'm actually getting the full weight and that my leg can accept the full weight. So take a big breath in, I contract, I relax, and then I'm free to play. If I want to bend my leg and change the angle a little bit, I can. What's nice about this, though, this long lever or straight leg shape, gives us an opportunity to work on tissues sometimes that we want to be in these shortened ranges, but this long lever position really highlights specific dysfunctions. We have a short lever variation we call pain washing, but what I want to do is make sure that I'm, in fact, just addressing different aspects of my quads, and in this situation, it really does work best in this long lever shape. Leg underneath me allows me to support and modulate load, hold up the body with the rest. If you need to stack your head, feel free to knock yourself out. Keep an eye on your breathing, and if you scan side to side, and you can't take your full weight on anything, by all means stop and contract, relax. If that's feeling good, move on up and just start that scanning process again. And if you get it to the outside and it feels a little bit tender, make sure that you actually can contract and relax to desensitize that, to tell your brain that's not a problem. And what's happening now is I had a good relax, but I'm not completely able to relax entirely, so I'll take another breath again. Engage the glute, flex the quadriceps, hold for 4 seconds, and then slowly exhale and see if you can relax all the way. And now I'm actually at the bottom of that well, and then I'm going to move on side to side, scanning in that half circle, and then make sure that I can actually scrub a little bit too. So it's easy to neglect your quadriceps because they are not fun to mobilize, and this is one of the reasons that we feel like a 3-minute effort per leg is really a reasonable amount of time to wrap your head around this intervention. So scanning side to side, looking. If I find something that feels stiff or restricted, or can't take my full weight on, or I stop breathing, I'll make sure I can squeeze my glutes, flex the quad, and relax into that. You can even do some scrubbing and come back to that, contract, relax. But the bottom line is scan, scrub, and do that contract, relax, and make sure that you're doing the work on a smaller amount of tissue than trying to roll your entire leg musculature. So this is our basic quad smash with either a ball or a roller in that long lever, long leg position. This is a simple shin smash or soft tissue mobilization of the anterior compartment of your leg. You're gonna need a roller or some kind of peanut. What we're gonna do is we're gonna start at the base of the knee. So notice what I've done here is that I've gone ahead and supported the back leg with the other foot. This allows me to normalize my pressure so I'm not sort of in this strange shape. What I'm gonna do is make sure that I think about my shin starting all the way up at the base of the patella. And what I'm trying to do to start here is see if I can spend 3 minutes working my way down from the base of the knee, pushing and pulling so that I can improve how that entire compartment of the front of the shin is articulating with its neighbors, as well as capturing the actual shin itself. So I'm working side to side here, and I'm just scanning side to side. I can take some real pressure through the front of the shin. When we do postmortems on people who have shin splints, we ask them, have you ever mobilized your shins before? And it turns out the answer is no. And in people who heel strike chronically, the shin is always stiffer than people who run the way they would if they were barefoot. So notice that I'm working my way down, and then I'm also pushing and pulling. So I'm trying to, each time I get here, I'm trying to tack the tissue as far as I can one way and try to pull it the other way so that I restore those osteofascial connections, which are connections between connective tissue of the fascia and the bones. So thinking about how that system is articulating as a whole and trying to grow the size of the glove. So side to side, plus a little bit of shear and scrubbing side to side makes a big difference. Then I just continue to work my way down, and it doesn't take ton. There's this tissue system is not that large, but a little push and pull, a little side to side, and I just keep working my way to the base of the shin. The key here is that we're thinking of this as in a total global system. So it's not just one aspect of the shin, like the middle of the shin, but we're really looking at the whole length of the tissue. So again, side to side, plus a little bit of scrubbing, and I just keep working that down. And then eventually I can get my leg out of the way because I get my middle of the shin supported by the roller, and I'm just taking my time going from bone, what feels like to the outside, that peroneals or lateral compartment. And then I just keep working that down, a little bit of push and pull. So can I almost grab the skin and create a Sharpei-like motion at those bony interfaces. And notice that as you do that, it's going to push and pull the whole calf system around. Working lower, I can even add a little foot motion in if I wanted. And if I find a spot that feels too tender, I can back off my pressure with my hands, take a big breath in, contract into that roller and relax, and do your standard contract relax here. So 4-second inhale, 4-second hold, 4-second relax. But for me, this just feels, I think the word is good. So just working my way down, coming up on that 3-minute mark, and I've worked all the way down until I've hit about the base of the shin. And you can see I've left some little bit of impressions here. This is also a nice test to see how well hydrated you are. And if you're congested or if you failed to remove a lot of the congestion, swelling from work, you'll see that you'll leave large imprints that will stay imprints for a while. So hitting up this other side, starting at the shin, and just right up at the base of the knee. And so the quadriceps are inserting right here onto this bump on the tibia. It's called the tibial tuberosity. And I want to make sure that I'm addressing that system all the way up to the base of the knee here. So pushing and pulling. So I'm thinking about giving slack to the quadriceps tendon even through that anterior shin. We've got to see this line of force through the front of the leg as contiguous and running down the front of the shin. So when I improve the relationship, I'll be feeding slack upstream as well. So a little bit of side-to-side slow motion, rolling. Notice that I'm not rolling front and back. These tissues are really adept in handling that long axis load. So we really appreciate rolling side to side. And 3 minutes a leg makes this a nice companion piece to a lot of other things. If we're looking at restoring knee function, we've got to be talking about the shin. If we're looking at restoring ankle function, we have to be talking about the shin. It gets lost oftentimes in the language of talking about improving your dorsiflexion, but we absolutely need to make sure that we're addressing this tissue system. So working side to side, plus a little bit of scrub, intermediate, just making sure that those tissues actually articulate, and then just working my way down. And 3 minutes feels tight, but we'd rather you have a dose and a response. And by all means, if you want to spend another minute here, do so. But it's nice is that I can support myself on the roller and then just roll side to side, a little bit of shear. And as I run down the base of my leg, I start running out of shin musculature and I start running into musculature of the peroneals. So a little bit of side to side, a little bit of slow work through the front of the shin. Keep scrubbing, scrubbing, again, side to side. Can I push and pull that tissue to the limits of excursion? It runs out, it feels like I've just tacking the sheet on the corner of the bed. That's how tight this is sometimes at the end range. Pushing and pulling until I get to the base of the shin. Rolling side to side, taking your time, making sure you're not holding your breath, and then just trying to scrub that back and forth. An easy way of upregulating the function of your foot and your lower leg with these little bit of interventions. So again, starting at the top of the knee here, thinking about this whole compartment, scrubbing, pushing and pulling to the base. 3 minutes to get the job done. Couch stretch is a ready state staple. What we're really trying to do is take the lower leg, put it into flexion, while simultaneously trying to extend the upper leg. So we've got a couple variations here, and one of the variations is I'm going to put my front foot on a platform for a more advanced mobilization. We start with both knees on the ground, back knee goes into the corner. We're going to try to accumulate 3 minutes in this position. So first of all, can I squeeze my glutes into this position? So that we treat couch stretch as much as an assessment and a skill developer as I do an end range isometric developer. So I've got my knee in the corner, I'm pressing my hip to the ground, and notice that I'm not actually on my kneecap on the back, I'm in front of the kneecap. It's one of the reasons we want the knee all the way to the corner, not on the kneecap. Leg is pointed, so I lengthen the fascia. The second position is to bring the leg up into a high kneeling position. And for a lot of people, this will be the end of their available range. What we're going to try to do is squeeze the butt and press the hip to the ground. And I can oscillate in and out of that end range, grabbing the glute, trying to remain engaged, that posterior. And then I can even do a contract relax here. So I take a big breath in, drive my knee into the ground, forward, squeezing the glute at the same time, and then slowly relax, and then just moving in and out of range, but trying to keep the glute engaged. If I can go a little further, sometimes it's helpful to have a chair or a roller. It just allows me to relax, or I can just use my leg. In this position, I still can progress to here as long as I can still squeeze my glutes. So I can reach around, just do a glute check. And what I'm going to try to do here is that same process. Can I squeeze the butt and bring the hip forward to move towards extension in this position? Now, one of the common mistakes is that we will flare the leg out to the side. I want to try to keep the knee in line with the pelvis. Otherwise, I'm sort of dumping tension. Ultimately, we're trying to get the knee back to the wall, rib cage down, so I'm not flaring and creating a little additional space. Squeezing the butt will tilt the pelvis posteriorly, rib cage down, and I should easily be able to breathe here and still be able to access my glute tension. So once I can do that, I can take a big breath, drive my knee into the ground, end range isometric, and relax. Watch my breath volume, get a couple recovery breaths, and then I can even move towards this end range. So trying to take myself to work on this through range muscle contraction, through range muscle stiffness while the glutes are engaged. So protecting the back, making sure I tie this system together and then press the hip forward. You'll find that as you become more confident at this and more competent at it, that raising the front leg up onto an elevated surface will increase the load and demands through the back leg. So what ends up happening now is that this leg drives into flexion and I increase the load demands through the middle of the quadriceps. So again, how do I know I'm in this position and that's valuable? I can squeeze my glutes, still maintain the integrity of my breath volume, and I have access at this end range position. So once we've hit about 3 minutes on one side, we'll switch sides. Again, I'll go ahead and do the same setup as before. Back knee to the corner first. Make sure that I've got access to the glute. I'm not going to assume because one side is easy that the other side will be automatically easy. We're looking for differences side to side. I can bring that leg up into that high kneel position. And again, give my tissues a chance to adapt. Keep the glute engaged, moving towards end range. Keeping the butt on teaches me that I can still access my glutes even though I have great tension through the front of the leg. A lot of common gluteal inhibition problems often are related to the fact that people just haven't trained themselves to be able to access the glutes against the stiff hip, or the stiff hip prevents the access to the glutes. So being able to squeeze the glute, press that hip forward, and then just touch that. Now we're not bouncing, we're just touching at end range, and we're making sure that we have neuromuscular control. So small movements at end range where the butt's engaged, moving further and further up. If I've got the space and the capacity, I can throw that leg up onto an elevated surface. Again, this is just easier to keep myself up while I talk to you. You could use a PVC pipe, or you could use just your leg. Here, I'm going to drop in my contract, relax, take a big breath in, drive my leg into the ground, hold for 4, slowly relax, and I'll recover with a couple breaths. Big breath in, big breath out. Trying to use my breathing to fill up the space and to use my diaphragm to challenge some of the fascia that's going to be implicated between the hip and the upper body. So again, moving and being dynamic this whole time, instead of just a static end range where everything is off and I'm just pulling on tissues. I'm trying to teach my brain to be able to access the glutes in this position and move towards end range and keep the glute on. As I get more and more comfortable, I continue to push myself to the wall, keeping an eye on over banana backing, and then take a big breath in, squeeze that glute, drive that knee into the ground, hold, 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 and relax, and keep moving. What you'll find is the first times you're doing this, 2 minutes seems like a long time, much less 3 minutes. A lot of times people will get in and out of this position for 20 or 30 seconds. The goal here is to do your best to be able to be active with that posterior chain, to be able to recruit the glute, and be moving towards this end range actively while supporting your breathing and supporting that hip with that glute engagement. So big breath in, drive the knee into the ground and hold, hold, hold. Classic contract, relax at end range, and then giving the tissues a chance to lengthen with time under tension. Couch stretch is a staple and should be a staple in your diet as well.